Started.
Mhm. Okay. So in last class we have seen suture material, their some characteristic properties and their advantages or disadvantages. Suture patterns, there are multiple classification in different books, but broadly they are divided into two classification. Broadly there are two classification, and other materials or other patterns we put into miscellaneous type. So first classification is interrupted. This is interrupted, and second classification is continuous type. Means this pattern where we suture, that may be interrupted or continuous type. And the second classification, that is appositional type and inversion type, and the last is eversion. This classification, interrupted or continuous, this classification is based on, this is based on placement method. How you place your suture material, either interrupted or continuously. But this classification, a positional inversion or eversion, this is based on the effect on wound margins. So there are two main classifications. First is based on the method of placement, how you place your suture material, either interrupted or continuous. Second is based on wound margins. Suppose the wound margins, they come close to each other and they are facing toward each other just like mirror image of each other. They are called appositional. And inversion. There is one Reumann. If the sutured edges are inverted, means they are facing toward the lumen. That is called inversion, and eversion is the, this is the eversion type where they are facing away from the lumen. So these are the two basic or broad classification of suture material, where the first suture material classification interrupted and second is the continuous. First we'll start with the interruption. Interrupted suture pattern. Interrupted means like this. It is having a knot. That is the full stop or interruption. This. Such kind of pattern is called interrupted, which is having starting point and it end with a knot. Opposite to this, there is one suture pattern, it is continuous. In case of continuous, there are only one and two. There are only two knots. So interrupted pattern, for example, this is your simple interrupted pattern. Simple interrupted, where multiple knots are there. In case of simple continuous, there are only two nodes. The advantage of this pattern over this is, if you open at this end, the whole suture pattern will become open. But in this case, if because of excessive pulling or scratching or licking of the animal, if this bite open, then remaining wound will be there. But because of these knots and the foreign suture material is a foreign body, it gives more foreign material, foreign body, inside a wound. This is a small disadvantage for the simple interrupted as compared to simple continuous. But every pattern has their own advantages and some other disadvantages. So interrupted pattern, they are of following types. First is your simple interrupted. First is simple interrupted. Simple interrupted where this pattern is created. All the nodes they are lying on one side of the incision. This pattern is normally appositional type. It means these are the two edges of a wound. It brings these edges near to each other, opposed to each other. If we apply, if we apply more force, it means if we tight this suture material, if it is too tight, then instead of opposition, what will become the end result will be inversion. So with simple interrupted pattern, they are normally used as oppositional type. They oppose the two edges of the wound. But if you apply more tension, more force, if you tie these suture patterns more tightly, then inversion will occur. What will happen if inversion occurs? Because of this inversion, it results in poor healing of your wound. Poor healing. Poor healing of the wound. So, skin sutures, skin sutures, if you are applying a positional type, they should be that much tight enough that only apposition will occur. If you apply more tension, if you pull these suture or tight it tie it too tightly, then inversion will occur. Because of inversion, there will be poor healing. So this is the disadvantage if you apply them more tightly. So normally simple interrupted are your appositional type of suture pattern. These are applied in case of skin, subcutaneous tissue, and your some viscera. Second type is your matrix pattern. This pattern will tell you M for multiple penetration point. Multiple penetration point. These matrix patterns are of following type: horizontal, vertical, and cruciate. These are interrupted one. These are interrupted one. Then we have Cushing, Lambert, we have Jobert, we have Cornell. These are continuous type. These are continuous pattern. So matrix pattern is that pattern which is having multiple penetration point. The meaning of this word multiple penetration means suppose you are applying simple interrupted. To apply simple interrupted, this is the point A from where our needle enters, and this is the point B. It is the exit point, and this is the entry point. So there are only 2 points, one from the entry, one from the exit. Then you simply tie a not. But in case of matrix sutures, there are multiple points. For example, in case of horizontal matrix, this is entry point, this side exit, then you go along the incision, then here exit, then entry, then here exit. So there are A, B, C, D. These and we tie it here. So 1, 2, 3, 4. There are 4 points in case of horizontal matrix. Similarly, in case of vertical matrix, there are 4 points. In case of cruciate, there are 3 points or 4 points. So these are multiple penetration points. So we call them matrix suture. First matrix suture is your cruciate type. Cruciate means cross type. How these are formed? First, normally they are oppositional type. Means they oppose the wound edges. Suppose this is the incision line. This is your incision line. These A and B, these are the wound edges. In this case, in this cruciate, we apply two simple interrupted suture parallel to each other, and then we tie them. It means this is the, suppose A is the entry point and B is the exit point. This is how it enters, then C, then D. Entry, exit, then again it enter, and from point B it exit out. So these are the two, this is end and this is also end. We tie these two ends. After tying, the structure becomes cross, so we call it cruciate. So there are two simple interrupted which are placed parallel to each other, and we tie them at the end. Here if we tie like at this point, because these two are the ends. So this cruciate type or cross matrix sutures, where we apply, that is more important. First is the skin. The part of the skin where tension is more, we apply cruciate or cross matrix. The more important is which skin. Suppose there is amputation of femur. Amputation of femur. The skin which is left after the amputation of the femur, at that skin we apply this oppositional type cruciate or cross matrix. The advantage of this cross matrix over the interrupted suture pattern is the strength, or it is more stronger, or the strength of this pattern is better than the simple interrupted pattern. And the second important thing is amount of suture material required in this cruciate is less than the simple interrupted. So the cruciate type is an oppositional type which opposes the end. After the amputation of the femur, we want to oppose the skin flap. So we apply cruciate pattern. In this case, there are two simple interrupted placed parallel to each other, and at the end we join these two ends, these three ends A and D, and after joining it becomes like a cross. So we call it a cruciate or cross pattern. It is more stronger than simple interrupted, And this pattern is also a interrupted type. This is the skin and edges. After applying, it will be like this. Multiple crosses will be there. Next is horizontal matrix and one is vertical matrix. Vertical matrix. Both are a type of appositional suture, but they cause eversion of the margin. If we look at the eversion of the margin, then horizontal matrix causes more eversion as compared to vertical matrix. So normally we use these two interrupted pattern to oppose the skin wound edges. But these two patterns they causes eversion of the margin. Horizontal causes more eversion as compared to vertical matrix. As these are matrix suture, so there may be some multiple penetration point over the. So how it started? First is horizontal matrix. In this case, we form a square. The pattern is in the form of a square. Suppose these are two edges of a wound and this is the incision line. We make an incision and these two are separated. These two are edges. We start from this point A. From this point there is entry. We enter. After entry, first is entry. After entry we cross the incision line. Then we exit. Point B. Exit. Entry, then we cross the incision line, then exit from point B, then through the skin parallel to this incision line, we go for 6 to 8 millimeter. 6 to 8 millimeter. Then we come out from this point, then again cross the incision and exit from here. After coming at this point, these two are tied together and we give a knot. So at the end, the suture pattern look like a square. So this is the horizontal matrix. Horizontal means this is the incision and this is parallel to the incision. This is horizontal to the incision. So there are 4 points A, B, C, D. These are the points where your suture ends are there. We tie them with the help of a knot. This will study later. That may be your square knot, that may be your surgeon's knot, or that may be your triple knot. So in case of horizontal matrix suture, this line is parallel or horizontal to the incision. So where we apply this horizontal matrix suture? Mainly on the skin, where tension is more. For example, there is hygroma operated at knee in case of dog. So we can apply horizontal matrix at that place. In case of vertical matrix, see, if we compare, these are the two edges. We enter from point A, then B, parallel, C, then D, and then we tie a knot. This is the knot. In case of vertical matrix, these are the two edges at this is the place where we put incision. After taking incision, these are the wound edges. In case of vertical matrix, this is the point A. This is your entry point. After going inside, we come out at point B. This is the exit point. Then we reverse the needle and enter here. This is again your entry point C. Then we cross incision line and exit from the point D. So the vertical matrix, point A, B, this is far point, this is also far, C is near, and D is near. Everything is in a perpendicular line. Everything is in a vertical line. So we call it vertical matrix. Vertical means vertical to the incision. Matrix means multiple penetration point. Here 1, 2, 3, 4. And this, because of the pattern, first we started at the far point A, then far point B, then C, then D. So this pattern is also called far, far, near, near. So vertical matrix pattern is also called far, far, near, near. Because first entry was far, then exit at far, then entry near, then exit near. After coming out, these are the two ends A and D. We tie a knot at this point. So in this case, horizontal matrix, this is horizontal to the incision line, and in this case, it is vertical to the incision line. So the advantage or disadvantages of these two matrix suture are, if we look at the skin, suppose this is a piece of skin. In case of canine, in case of cat, in case of dog, the blood vessels, they run parallel to the skin surface. So if we apply our suture pattern like horizontal, because of the compression, they cause local ischemia. They cause local ischemia. The skin, this is skin, and these are the blood vessels. In case of dog and cat, the blood supply is parallel to the skin surface, and the horizontal matrix is also parallel to the incision. So it compresses these vessels and compromise the blood supply. Because of local ischemia, there will be delay in healing. Delay in healing. Because of delay in healing, there are more chances of wound dehiscence. Means it may split, it may get open. So this is the disadvantage with the horizontal matrix, where because of the pattern, in case of human being, in case of pig, the blood supply is perpendicular to the skin surface. But in case of dog and cat, this blood supply is parallel to the skin surface, horizontal compress the supply, local ischemia, delay in healing, and there may be chances of wound dehiscence. So the disruption of blood supply is more with the horizontal matrix pattern. So blood supply disruption is more with horizontal as compared to vertical. This is because of the parallel blood supply of uh, cat and dog cutaneous vasculature. So if we compare these two, horizontal and vertical. Vertical is more stronger. Vertical is more stronger than horizontal. There is less vascular disruption. Blood supply is disturbed less. Here, more vascular supply disruption. And in case of horizontal matrix, it is horizontal to the incision, and this vertical is like this, vertical to the incision line. This vertical is normally applied in case of teeth fistula, and horizontal we apply in case of skin, like hygroma closure at the point of elbow. Then there are more interrupted patterns. One is Halstead. Halstead is nothing but your interrupted Lambert. In continuous, we'll see what is the Lambert. So the interrupted pattern of Lambert is called Halstead. And this Lambert pattern is nothing but far, near, near, far type. So Halstead is also a far, near, far type. But in which manner it is interrupted. And the next is Gamby, also known as crushing type. The two ends of the intestine, they are connected to each other. So Gamby pattern is used for intestine anastomosis. So these were some of the interrupted pattern. So interrupted pattern was simple, then matrix. Matrix were cruciate, horizontal, vertical, and last were your Gamby and your Halstead, which is nothing but interrupted Lambert. So these are interrupted pattern of the suture. The second major pattern is the continuous pattern. Second is the continuous pattern. Continuous pattern, suppose this is, we apply a knot here and then it is continuous. Then again there is one more knot. So in case of continuous, there are total two knots. First we'll see the types of continuous pattern. The first is simple continuous. Similar to this, there is one pattern called running suture. Running suture. There is a small difference. These are the two edges of the wound and incision line. First, we'll apply here a knot because simple continuous starts from here. So we cut this end small, okay, it's small end. We apply a knot. First time we enter from this side to this side. This penetration of the suture or the needle is perpendicular. and this is below the skin. Not below the skin, this is below the incision. The first entry is in perpendicular direction and it is below the incision. Second time from here we come at this point. This this is A and this is B. A is perpendicular and it is below the incision, and the B is above the incision, and it is not perpendicular, it is diagonal. So this is your simple continuous, where below the incision, the point A, below the incision, we come perpendicular. But after coming perpendicular, then this is diagonal. Then perpendicular, diagonal above the incision. Then below the incision, perpendicular. Then we come to this side by above the incision, diagonally. In case of running suture, there is similar pattern. First we apply a knot here. This is the knot. But at this point, the below the incision is also diagonal. Above the incision is also diagonal. It is like this. So in this case, below and above incision, it is diagonal. So these are the two continuous pattern. One is called simple continuous, one is called running suture. In simple continuous, first we apply a knot, then from this side, if we come to this side, below the incision, then it is perpendicular. If we come from this side to this side, it is diagonal and it is above the incision. Then again, below the incision, diagonal, below the incision, diagonal above the incision, and below the incision perpendicular. This is the pattern simple continuous. Running suture, both below and above the incision, it is diagonal. So these are two simple continuous patterns. So this is your knot and A, then this is B. This is the simple continuous. But suppose this is the loop in simple continuous. Before going to further forward, we take one lock in this loop. If we lock it like this at this end, and we lock it. So in this loop, if we bring the needle like this, it becomes partially locked, and then it is called lock stitch suture. It is also called fold interlocking suture. Interlocking suture. So because of locking, it is called interlocking suture. And once this loop is created, before going to next loop, we take one lock inside this. So it becomes lock stitch or fold interlocking. The important point for the lock stitch is the use of the lock stitch. In case of diaphragmatic herniorrhaphy, in case of DH, diaphragmatic herniorrhaphy, we use this pattern, lock stitch pattern, with material silk, and number is 3. So the hernia closure is with the help of lock stitch pattern. In case of ruminant, the large muscles, they are also closed with lock stitch pattern because this pattern is more secure and more stronger than simple continuous. Then there are some inversion type of pattern. They invert the edges. First is Lambert, second is Cushing. First we'll see these two. There are many others, Joberts, Cornell, and bursting sutures. So first we'll see the Lambert. From the name itself, Lambert is E for accept, M for mucosa. M for mucosa. There are four layers, 1, 2, 3, 4. The fourth one is mucosa. The Lambert pattern, we enter up to the submucosa. Means except mucosa, only three layers are entered. So mucosa is not entered. This is your Lambert. If what happens if we add Lambert plus mucosa, then the name will change to Jobert. Jobert. Lambert is except mucosa without taking the mucosa. Only three layers. If we take mucosa with the Lambert, it will become Jobert. So Lambert is nothing but your continuous vertical matrix suture. If vertical matrix suture is taken as continuous pattern, then it is called Lambert. How it is taken? Suppose these are the two edges of the wound and this is the incision line. We start from point A. We enter from this point. Then the same side without crossing the incision, we exit at point B. So first entry at point A and then exit at point B. Then we cross this incision line. We come to point C. After exit, we again enter. Then from this point D, again we exit. Say in case of vertical matrix, after exit we move in this direction because that was interrupted pattern. In case of Lambert, from A to B, then C, then D. After this, we come to this side. Again point A, entry, B, exit, we cross the line, reach the point C, we enter, and at D, again we exit. Again, because it is continuous pattern, we move to this side, A, B, C, and D. We come to this side. Again, this side. Every time, in case of Lambert, this penetration of needle is perpendicular to the incision. So Lambert is perpendicular to the incision. See, every time the penetration point, these A, B, C, D, they are perpendicular to the incision. A, B, C, D. Because it is continuous, so we come to this side, then we come to this side, then this side, then this side. So these points A, B, C, D, they are in one line and they are vertical, perpendicular to our incision line. So this is the Lambert. Where to apply Lambert? We apply in hollow organs like rumen, like uterus, gallbladder, in cesarean section, in rumenotomy. So we apply Lambert. So now you know what is the Lambert. Lambert plus mucosa equal to Joubert. If we place the two rows of Lambert, then again the name changes. It is called CZERNY, journey suture. This was asked in one PSC exam, that what is the terminology used when double row of Lambert is taken. In one exam they asked, if we take Lambert with mucosa, it will be Joubert. After Lambert, Joubert and your journey, there is cussing. Again, in case of Lambert cussing, both are except mucosa. Except mucosa means we enter only three layers. But the cussing H helps you to remember H for horizontal, or horizontal means parallel. Means in this case, these are the wound edges. First we tie a knot because it is continuous pattern. Then after tying a knot, we enter at point A. Same side, we come up to this and exit from B. Exit, and this is entry. Then we come to this side, point C, then come horizontally at D, then come to C. So in case of cussing, we are parallel to the incision line. Again, coming to this side, we are parallel to the incision line. Parallel or horizontal. So cussing is horizontal and your Lambert is vertical. So the differences between Lambert and cussing is very important. Lambert and your cussing pattern. See, first is both are same, means except mucosa. Here also except mucosa. Means only three layer penetration in both cases. Second is, this is perpendicular to incision, or you can say vertical. This H will help you. It is horizontal or parallel to incision. The next difference is after suturing. Once you suture, after suturing, suture material, suture material is visible in case of Lambert. But in case of cussing, after suturing, if you want to see the suture material, the inversion is like that कि suture material is not visible to your naked eye. Not visible. So these are three differences. Both are three layer except mucosa, perpendicular, parallel. After suturing, if you see with your naked eye, the suture material will be visible. In this case, material is not visible. Then, for example, C-section. In case of C-section, we take two-layer closure. Two-layer closure. In this two-layer closure, the first layer we usually apply cussing, and second layer will be your Lambert. Second layer will be your Lambert. For the better apposition, better closure of the uterus. Then there is one more pattern. Okay. After cussing, there is cornel. Cornel is nothing but cussing plus mucosa. It means it is four-layer suturing. Just like Jobert is Lambert plus mucosa, cornel is cussing plus mucosa. It includes all the four layers. It enters into the lumen and then come back. The next pattern is SCH Smeden pattern. From the name itself, this pattern is a modification of S and your C. S for simple, C for continuous. So this pattern is simple continuous pattern. Then what is the pattern? These are the two wound edges, incision line. First we'll take one note here because continuous pattern means we start with the simple interrupted note. Okay. Then in this case, this we first enter from the mucosa. This is your entry point. Entry point. Number A. This is the entry point. Means this suture is not coming from this, it is not penetrating this side. Directly we are coming to mucosa. This is the entry point. After coming to mucosa, suppose we come out at this point. That is B is your exit point. Then from here will come and again this time C is your entry point. This C is again the mucosa. Then we come out at somewhere here D. Then again mucosa entry point, then exit E, F, then again Z entry point, then H exit again. This is the entry point I and this J is the exit point. So in this pattern, we are entering from mucosa, exiting from the serosa. Every time entry is from mucosa and every time exit is the serosa. Enter from the mucosa, exit from serosa. Then we enter the mucosa, exit from serosa. Then mucosa, then and exit from serosa. So entry is the mucosa, exit is the serosa. This is the pattern, and this pattern is normally this Smeden pattern. Previously they were using in intestine closure. After this pattern, there is one more pattern which was asked in ICAR 2018, and that is your Parker care. It was asked in ICAR 210. After doing ovarian hysterectomy, pyometra cases or elective OHG, there is one stump, uterine stump, and we close this stump. For the closure of this stump, Parker care is used. How it is used? Suppose these are the two edges. Wait. These are the uterine horn. These are the uterine horn, and this is the uterine body. These are the uterine horn, uterine body. After removing from this point, we want to remove from this point, the uterus to be out. This is the stump. This is the remaining stump. To close this stump, we use the pattern that is called Parker-Care pattern. This stump. How to close with Parker-Care? This PK, Parker-Care, is nothing but a combination of Cushing plus Lambert. It is a combination of Cushing plus Lambert. This is the stump. This is the stump. First, what we do, we apply. This is our forceps. This is our artery forceps. We apply artery forceps like this with help of artery forceps. Over this artery forceps, we take our suture material and first we start. Okay. First we apply a knot and we start cushing. Cushing is continuous and it is horizontal to the. It is parallel to the incision. So after applying this cushing up to here, what we do, second step, we remove our forceps. Remove the artery forceps. You remove the forceps. Cushing is over. After removing the forceps, pull the suture material. It may invert the edges. Remove the artery forceps. This is the stump which is closed because of this horizontal cushing layer. One end was here, and with the help of another end, now we come at this point. This is the another end of the suture material. Now we start Lambert, and Lambert is perpendicular to the incision like this. After entering to the original point, after coming to the original point, we tie these two ends with the help of a knot. This is how Parker-Care is placed. Parker-Care is a combination of Cushing plus Lambert. First we apply a forceps. Above the forceps, we start taking Cushing. Once we reach at this end, we remove the forceps and make it tight, and with the help of this end we take second layer, that is our Lambert, and we tie a knot. So this is how first Cushing and Lambert both are applied, and this is called Parker-Care, and we close the stump in case of ovirhysterectomy. After Parker-Care, there is one commonly used bursting suture. Normally, in this case, mucosa is not involved. This is the anus, and around the anus we take in circular fashion, and at the end we tie. So to close the opening, anus opening, we apply bursting suture. It is very simple. The important is the use is to prevent recurrent rectal prolapse. Main indication, recurrent rectal prolapse. Second indication, suppose you are doing any surgery, tumor removal in the perianal region. So to prevent the contamination from the fecal material of anus, we close the anus temporarily with bursting suture. We do the surgery, and after the removal of tumor from this site, we open the anus. This bursting. The next is overlapping suture. It was asked in our PhD 2019. VO exam, that overlapping suture. Overlapping means after suturing, the skin flap, they overlap. They overlap. Suppose these are the two edges before suturing. After suturing, they come near to each other and they overlap one above the other. So overlapping suture, it suture the two edges and these edges final appearance will be like a overlapping. This suture pattern is applied, overlapping suture pattern is applied in U shape. How it is applied? For example, these are the two edges. So in case of hernia repair, repair, suppose these are the two edges of the hernial ring and we want to close the hernial ring. So these are two edges of the hernial ring. We start from here. This is our A, that is the entry point. Then point B. Here we exit. After exit from this point, we come to point C. Then we take horizontal bite. This is your entry and this is your exit. This is the exit point from the mucosa. Again, from this point, there is entry. E point. And finally, this is the exit point, F. And these 2 points, they are tied with the knot. Tied with the knot. So this pattern, it is applied in U shape. This is applied in U shape. So first we enter this side, then exit from the mucosa. After exiting from mucosa, then we enter from the serosa. We go parallel to the incision horizontally, then exit from here, then again entry from mucosa. So if you look at this point, first is entry from the serosa, second exit is from mucosa, then this is serosa, this is also serosa, and this is mucosa, and this is the serosa, and we find it. If we are talking about intestine, because serosa is present in intestine, so if this is the entry point, then exit from the mucosa like this. So it is applied in U shape to repair the hernia. So overlapping suture, U-shaped suture, they are used to close the hernia. So we have seen inversion pattern. That was Lambert, Jobert, C. Zerning, Cussing, Cornell, and Purstring, and PK, Parker Care, and SCH Smeaton, and your last one, overlapping. This is not inversion, this is simply overlapping. So these are the suture patterns. The next is suture patterns which are used for tendon repair. Tendon is slow healing tissue. In ICAR 2018, it was asked Bonell Mayer it is used for the tendon repair. In ICAR 2021 net exam, the question was three loop pulley suture pattern is used for the tendon repair. There are three loops at 120 degree to each other, three loops. And the last one is your Kessler, Kessler, and one is Krakow. So these are the four tendon repair suture pattern. Bonell-Mayer, three loop pulley suture, Kessler and Krakow. Their name is enough because in competitive exam they only ask that this pattern is used for tendon repair. Which of the following is not used like that? Next topic is the knot. What is a knot? Suppose we are applying simple interrupted or simple continuous. So this is the knot is the weakest point of a suture. It is the weakest point of a suture. In case of continuous, we apply one and this is two. Only two knots. In case of simple interrupted, one knot for one interrupted suture pattern. Only one knot. This is the one. So knot is the weakest point of the suture material. There are four types of knots. First is granny. Second is square, which is also called reef knot. Third is surgeon's knot, and fourth is triple or nylon knot or reverse knot. There are 4 to 5 names for this one. So first is granny knot. In these three, we take two throw with the help of a needle holder. If we come in case of these two throw and in case of the name itself triple, so there are three throws taken. So what is the difference between these three knots? The first is first throw. This is clockwise. Second throw is also clockwise. It means with the help of needle holder, we take first clockwise, then second throw is also clockwise. Means there is no crossing. Okay. In case of square, the first throw is clockwise direction. First we take clock, and the second throw it is in anti-clockwise. So we are coming opposite. That is, there is crossing take place. In case of surgeon's knot, first time there are two throws. There are one, but there are two throws and they are clockwise. After this, one throw and that is anti-clockwise. So there is also crossing. In case of triple knot, first there are two throws clockwise, then one anti-clockwise, and the next one is again clockwise. So there are three throws and there is also crossing because coming in opposite direction. So square knot is most commonly used. Surgeon's knot more secure than square knot. More secure than square knot. And granny knot, it is called a slip knot, easily gets slip. So this knot is not used in suturing patterns because it is slippy. Suppose these are the two. This is first throw and this is second throw. There are only two throws in case of granny, in case of square, in case of surgeons. But in case of triple knot is used for those materials which are having loose knot. Nylon is the material which is whose knot are slippy, so we use triple knot, also called reverse knot, also called surgeon's knot with square for the nylon. And the name of this knot is also nylon knot. This was asked in Canvas PSC VS 2020. So in case of surgeon's knot, first time there are 1 and 2. Two turns are there. Then this is simple surgeon's square knot. So this is the surgeon's knot. If you apply one more throw here, then it will 1, 1, 2, 3. It will become triple reverse or nylon knot. So for these, remember this formula: granny, square, surgeons, and triple. First throw clockwise, second also clockwise. Is first clockwise, second anti-clockwise. First are two loop, they are clockwise, and second is anti-clockwise. In this, surgeons, then after the last third uh, throw is also added because it is triple one. They are only two. Two. These are only having two things. Then there is one more knot which is called Miller's knot. It is used in OHE. The pedicle, how the Miller knot is applied. See, this is the pedicle. First, we take one round like this. Second, after taking this, we go like we form a cross like this. We form a cross, and after forming a cross, we go over second loop, but under the first loop. Which one is first? Which one is second? This is A is the second loop and B is the first loop. So we started like this, then this is A is first loop, make it B. B is second loop. So A is, so we'll go below the A and we'll go above the B like this, and it will form Miller's knot. Then there is one more knot which is known as Aberdeen's knot. In case of canine prescrotal castration, we can apply Aberdeen's knot. Suppose we are taking simple continuous, then we make a loop, and from this loop we comes 2, 3, 4 times out, and then finally apply a knot. Finally, we apply knot there. So coming inside the loop 3, 4 times, then finally tie it there. That is Aberdeen knot. Then there is one term ligature. Ligature is nothing but the suture material that we are using. Using for what? We are using the suture material to tie bleeding vessels. During surgery, sometimes we cut blood vessels. To tie them, we use like suture material and ligate. That is the ligature. This ligature is of two types. One is known as simple or circumferential. Circumferential. In case of this, suppose this is the vessel you want to ligate. For example, you are doing OHE and this is the ovarian end and here is the suspensory ligament. So you tie here, then we cut. So to tie this, simple circumferential means what? We take a simple circumference around the vessel and simply tie here. And this knot may be your square knot, or some people use surgeon's knot here. So simple is we move around the vessel, around the circumference and simply tie. But the problem with circumferential or simple ligature is it can slip. It can slip. So to prevent this slipping, if we are using this ligature, this suture material for large blood vessels, in case of large blood vessels, there are chances of slippage. It can slip. So we have another option, that is second option, transfixation ligature. Transfixation. The meaning of transfixation means, suppose you are doing amputation of the femur. So in case of femur, there are big vessels. This is the femur and these are the vessels running around the femur, and you want to amputate here. So before amputation, what we do, we ligate these vessels, these large artery or veins, we ligate these vessels. So see, femoral vessels are large vessels, so we do not take a risk of ligating with simple circumferential ligature. So what we use, transfixation ligation. Means we have our suture material, suppose vicryl, and before amputation we ligate the femoral vessel. So how to ligate? What is the meaning of transfixation? This is that big vessel. We enter into the wall and come out. Transfixation means you penetrate the wall and come out. And after like this, and then you come this side and tie here. Here we apply knot, that may be square or circle. So in this manner, our suture material is fixed. Transfixation means our suture is fixed in the wall of blood vessel. So there are no chances of slippage. Suppose this is the vessel and simply you are tying like this. There are chance of slippage. It can slip. But in this case, you have fixed your suture in the wall of the vessel. Now, it may crust or rupture, whatever happen, tear off, but it will never slip because you have fixed into the wall, then you tied your suture. That is the concept of transfixation. We use transfixation where we do amputation of limb. There, large vessels are there. Second, we use transfixation in OHE in case of pyometra. Because in pyometra, there uterus, vessels, everything is fragile, soft. So we don't want to take any risk that vessel may get, the material may get slipped. So we do transfixation in case of doing OHE in pyometra and amputation of limb. But for cutaneous, small vessels or some small vessels, you can do simple circumferential trans or simple circumferential ligation. But for large vessels and for this pyometra and these cases, try to use transfixation ligation. So in this lecture, we have seen suture pattern that was interrupted. Interrupted was simple, interrupted, horizontal matrix, vertical matrix, and cross matrix. Then we saw continuous pattern. In continuous pattern, we have seen inversion type. Inversion. That was Lambert, Jobert, Cushing, Cornell, Parker Care, and Purstring, Smeden. Then we saw knot. There are granny knot and square, surgeon's, triple knot or Miller's knot and Aberdeen's knot. Then ligature. That may be two types. Simple, that is circumferential, and the last was your transfixation, that is better fixed in the wall of the vessel. So these are the topics we cover in this lecture.